Ladies and gentlemen, the SADA Young SES Award 2019 this time, the winner of this is Dr. L. Pillay. Are they in?
Good morning, everyone. I'm sure everyone's waiting to get the day going. Firstly, I'd like to thank all the academic support from Prof. Mabongo and Prof. Buch and Prof. Evans. Without you, it wouldn't have been possible to publish such a beautiful article. And my wife for the loving and the love, compassion, and support throughout the research. And thank you very much.
On our list is number 5, which is the SADA Branch of the Year Award. This year we've decided that we are going to recognize the first runner-up, the second runner-up, the first runner-up, and the winner. The first runner-up, and you will see in terms of the criteria, we will put it on the website. I'm not going to go through the details, but let's just go to the winners. The first runner-up is Northern Cape. Is Northern Cape here? I'm taking that award and I'm keeping it. Sorry? Yes. And the second runner-up is Algoa. Oh, sorry. What? I read it differently, but you understand what I mean. Okay. So the first runner-up is Algoa Midlands. Algoa Midlands, are you here? I saw some of you yesterday. Okay, we're going to keep these awards. My office is very empty. Now, ladies and gentlemen, I'm not quite sure what happened here with regards to the winner, but I think there's also biasness, quite honestly. The winner of this award is none other than KZN.
I must say thank you. Thank you to you guys. SADA is not just an association, but it's a family. And without the support of our family members, which are you guys, we will be nowhere. So thank you. And it's been an utter pleasure hosting SADA in our warm province of KwaZulu-Natal. Just mind the sharks.
Thank you very much. We have 2 humanitarian awards which we annually recognize those dentists who have distinguished themselves by outstanding unselfish leadership in the way they provide their services to the members and non-members of the public. This year, what I would like to do differently is I'm going to ask them to come here for these 2 awards winners. I would like them to give you a brief overview of what they do in 2 minutes. Again, we're going to put this upstage. The first winner is Prof. van der Heever. Please come upstage. Come on, let's welcome you upstage.
Thank you very much to SADA. Ladies and gentlemen, this is quite a surprise. We started the project called Making Faces, Changing Lives about 7 years ago. And I'm honored and privileged to represent a wonderful team at the Central University of Technology, the Center for Rapid Prototyping and Manufacturing, where we use 3D printing in the manufacturing of custom implants for patients who suffer from congenital, traumatic, or other defects caused by disease. Now, this team works tirelessly in restoring people's dignity, in making people who are mutilated by disease socially acceptable again, and improving the quality of life of their patients. I would also like to thank the Vice-Chancellor and the Deputy Vice-Chancellor of the Central University of Technology for believing in us and supporting us over the period of 7 years in difficult situations very often. Then all the surgeons at the hospitals, and I particularly think at the Kimberley Hospital Complex where it all started. From there it went to Midi Clinic in Bloemfontein, Perinomi, Universitas Hospital in Bloemfontein. We went to the Kalahari Clinic in Uppington. Life Chats Med here in KwaZulu-Natal. The Steve Biko Academic Hospital, Groote Schuur Hospital in Cape Town, and the Cure Day clinics in Pretoria and in Bloemfontein. And then to our sponsors, the Carl and Emily Fuchs Foundation, the National Research Foundation, the Department of Science and Industry, Southern Implants, Materialized from Belgium, and EOS from Germany. Thank you very much for your contribution. Without you, I would not be able to stand here. I thank you.
Thank you very much. The next humanitarian award is awarded to Dr. Ali Waja. Are you here? Please come through. I'm going to ask you again as well to just say a little bit about what you do so they understand.
Hello, everyone. So thank you to SADA for this award. So we've been treating differently abled kids, special needs kids, for approximately the last 21 years. A few years ago, we established what is called the Waja Kameno Trust. Really has not much to do with my surname, but Waja Kameno in Sotho means eat with teeth, which is in essence what our trust stands for. So what we do is we've basically got approximately 2,000 special needs people that have direct access to free dental care. But what we do provide is not just this per numbers kind of dental care, but we actually add value to the lives of these kids in many, many different ways. So we have dental education programs, we provide them with the various dental products, we have various fun days where we have plays, obviously with a big dental education component, we have professional entertainers with dental education behind them, and it's become a very big part of their social lives to such a degree where the schools actually prepare, it's on their curriculum for our dental health day. These kids participate by preparing plays, they audition for parts in their schools, the impact that component has had on their self-esteem is unbelievable. So when any of our team members enters these schools, they know my staff members by name. And that's a key thing in our program, because we don't just want to run into these areas and drill, fill, and that kind of stuff. So it's very much an integral part of their life enhancement. Beyond the educational component and supply component, we see approximately 10 kids coming through our dental rooms on a sustainable basis at various dental practices on a 2-weekly basis. As the program has developed now, these kids have the complete range of dental care as any of us would have here. From basic dental care to maxillofacial surgery, to implants, to professional access to maxillofacial surgeons, to orthodontists, to prosthodontists, and so on. We were even recently very fortunate where we had a maxillofacial surgeon from India join us to help with treatment planning and so on for our kids over here. Now, I'm just a representative for really a big team that works. A big shout out to the teachers that deal with these kids on a daily basis, the many dentists that treat these kids every day, the back support we get from people like Nadeem, you know, the various dental companies, the dental materials that we get here is supplied by various dental companies, in particular Milner's, the media companies have given us a backup, the Colgate companies, and the various other companies that give us the food. That give us the products. One thing coming to mind, when we have our dental day, we have Spurs Corporation, we have Wimpy, we have all these various companies coming out there and setting up kitchens for these kids. So when they are treated, they get the same fresh, warm burgers that you and I would get from Spurs. So it's really very much a life enhancement program rather than just a dental care. Beyond the dental care, they've got access, we've provided access to life coaches, to physiotherapists, and the works. So once again, just from myself, thank you very much to SADA.
Thank you. When you work with products on a daily basis, sometimes you think it is food. It does happen. Ladies and gentlemen, we are about to finish 2 more awards and we are done. This award is the SADA Premier Award presented to dentists who have made contribution of the highest distinction in the dental profession, both nationally and internationally. Ladies and gentlemen, for this year, the award is being awarded to one of the stalwarts of this profession who has just retired, and this is Prof. A.G. Lechtelem. Unfortunately, he's not here to receive the award. However, he has sent a representative, Mr. Tommy Madiba. Please come up front. I think I did say doctor. This is Prof. Lechtelem. I do apologize.
My age shows. Thank you. I am Dr. Tommy Madiba. I'm receiving this award on behalf of Prof. Attila Lechtelem, who is taller, but I have more melanin. I'm going to read what he asked me to read. I firstly have to apologize for not being able to be present today and to receive this prestigious award in person. Secondly, my sincere gratitude to the South African Dental Association for bestowing this enormous honor on me. It was indeed a privilege to serve the dental profession for more than 45 years and to make some contribution to the vision and mission of our proud profession. I was blessed to dedicate almost my entire professional career to the academic side of our profession, and from that side to serve the profession by making some contribution to research and development in the profession, by rendering much needed service to our community, and by providing our country with oral hygienists, dentists, and dental specialists of high quality. I wish to acknowledge the support from everybody who was in whatever way involved in my service to our profession. I thank you.
Thank you very much. Prof wanted to come, but he wrote me an email, something happened, which is an emergency that does not allow him to travel, unfortunately, but we wish him well. The last award that we want to give out today, it is the SADA Service Excellence Award. This is presented to any member of SADA for outstanding instances of service to the association and its structures, or who renders distinguished and exemplary services over a period of time. The person that is going to be given this award is a person that you have seen many times over the past few years from SADA platforms, and the person was nominated, the member was nominated, and they won the award. And ladies and gentlemen, without going into the details, the award winner for this year is none other than Dr. Yvette Solomons. Let's give a warm welcome to the stage.
Wow. Simplest response to SADA. Thank you for the opportunity to have served this organization over the many years. I'm honored, and it's not a bad thing to take pride in hard work, as Bruce has mentioned, that leads to amazing achievements. So thank you, SADA. I want to give credit where credit is due, to my Creator and my Heavenly Father for the gifting, the enablement, the capacitation, and the grace that never knew any bounds. To my husband, Dean, and our family, for all the family time sacrificed, the love, the assistance, the support, the warmth, the shoulders to cry on. This is for you. To the many colleagues and friends who made this achievement possible, to those who supported me, who held me accountable, CEO, put their neck out for me, invested in me, sacrificed for me, I thank you. There's a saying that goes, you become what you behold. And to that I say, to those who lived and modeled honorable, integrous lives with servant hearts, impacting and influencing the next generation, I want to let you know that this tree has grown and borne fruits as a result of seeds that you have sown. And I think particularly of my late parents, my teachers, my spiritual leaders, my mentors, my coach, and SADA's leadership structures of yesteryear as well as now. A final word to the future, to those carrying the baton onwards, some timeless wisdom from the Talmud. You can never be daunted by the enormity of the task to serve, to influence, and to impact. Do it now. Let love lead in whatever worthy of praise your hand gets to do now. You are obligated to complete you are not obligated to complete the work, but neither are you free to abandon it. Bruce mentioned the words, great and contributing. Do great things from start to finish. I trust that what you have seen during this Congress and during the awards, these awards, that they don't just get you to make a decision to serve, but to get you to be a disciple of intentionality and servanthood. So, my last words to you, seize the day, get involved now. Go the extra mile and kick butt. Do even greater things and never give up. I thank you.
It's okay, I can keep the award. Thank you very much. Thank you to the members that came and received the award. Let's give them a round of applause. We need to move forward. As we move forward, ladies and gentlemen, I know we're running late. We're going to our first clinical keynote speaker. Bruce, are you leaving? Are you coming back? Is he coming back? No, I want to give him something. I want to give you something. Please. Yes. At least you get a certificate from us, and you get something in there, and you can, and some cash. Thank you, Bruce. Ladies and gentlemen, our next speaker, Prof. James Curtis, has had various academic and administrative appointments during his long career and is currently the chair and medical director of the Department of Dentistry, Palmetto Health, USC Medical Group in Columbia, South Carolina, and an associate professor in the Department of General Dentistry at the Medical University of South Carolina College of Dental Medicine in Charleston, South Carolina. Prof. Curtis has been widely published and has presented at various conferences. And ladies and gentlemen, let us welcome him on stage and learn a lot about him.
Thank you. Good morning, Durban. It is about 4 a.m. in the United States.